Okay. Thank you for taking the time to come over. We're going to make this a very short and sweet presentation for you. We have Dr. Harry Boparai. He is an optometrist that graduated from SUNY Optometry School in New York City in 2002. In March of 2024, he joined his wife's practice, Eris Eye, in Bellevue, Washington. His interest has always been in ocular disease, and he has specialty interest in ocular surface disease. So with that, I would love to introduce Dr. Harry Boparai.
All right, thank you, everyone. Thanks for spending your late evening here with us. And um, I'm sure a lot of you have heard of Avenova and have used Avenova. It's not new anymore. It's been around for just a little over a decade now, I believe. Started off as eyelid cleanser, and then it was bought and changed to Avenova. But the formulation and the formula really hasn't changed, and the product hasn't changed. And so it really has a great track record. And I think you should, if you're not already incorporating into your practice, you should consider it. So let's move forward to the next slide. So again, it's 0.01% hypochlorous acid. It's used daily. I have my patients use it twice a day. So kind of like a start your day and end your day with Avenova. It is safe, easy, effective. Great for blepharitis, dry eyes, really any, even my patients with allergies during allergy season. I remind them to pull out their Avenova and get their lids clear, but it's just a good kind of habit forming treatment for their eyes. And then eye care. It's kind of like brushing their teeth. You brush your teeth, keep your Avenova right there with it, and go ahead and spray your lids as well. So, we see the word acid and think, oh my gosh, this must be something super dangerous or something harmful to the eye. But in fact, hypochlorous acid is a natural substance that's produced by our own white blood cells, and it's used to fight off bacteria, toxins, and infections. It's so really without hypochlorous acid, we probably wouldn't be around. We'd need hypochlorous acid. Our white blood cells need to produce that to fight off these infections and toxins. So it is a very natural substance. I still remember my rep from a decade ago coming in and just to show me how safe it was. He opened his eyes and sprayed his eyes directly and sprayed it into his mouth and onto his skin. And he said that it's this safe that there's nothing in here that's going to irritate your patients. And he was absolutely right. And it's just again a staple in our practice ever since. Next. So what's great about hypochlorous acid in Avenova is that it's broad spectrum. It's you can see this here list on the right of all the different gram positive, gram negatives, and fungi that it is effective in reducing bacterial count and fungus counts. It does, the gold standard, of course, especially for surgeons, is betadine. And betadine, is used, of course, in surgical procedures to prep the patient, prep the eye preoperatively. And the idea, of course, there is, pre-cataract surgery or pre-retinal surgery. You want to get rid of all the bugs and don't want to give them any chance to enter into the eye through the incision site. So betadine is kind of the gold standard, but in fact, Avenova is twice as fast. It works in 1 minute versus 2 minutes with betadine. And the toxicity level of hypochlorous acid is 1,000 times lower than betadine. I'm sure if there was a period of time where, and some of you may still be doing this in your office, taking viral conjunctivitis patients and using a betadine cleanse on their eyes. It is pretty harsh, and we know that those patients end up with a pretty significant keratitis afterwards. It does speed up the resolution of that viral conjunctivitis, but it is pretty tough on the surface. Not the case with Avenova. And again, you do get better coverage with Avenova versus betadine. So, what are some of the common, uh, you know, things that you could use Avenova for? Blepharitis, of course. Patients with blepharitis often end up with styes and chalasia. Demodex is huge. We finally have another treatment that is very effective. Of course, we've had the tea tree oil for some time, and now we have Xdemvy, which does a great job of controlling those Demodex mites and really getting the count down. But that's a 6-week course, and I have my patients when I'm treating their Demodex mites to at the same time start the Avenova, and the Avenova is something that they'll be able to continue to help maintain the control of that Demodex. Of course, we know we can never completely eradicate Demodex. It's kind of like trying to eradicate the dust in your house. Those dust mites are going to be there. Usually for me, I dust and 10 minutes later, I can see a nice little coating again. And so, it's always a constant battle. The same thing with Demodex. You're never really going to completely eradicate Demodex mites. Again, Xdemvy is a great tool to get those mites under control. And then for my office, again, Avenova is something that we can continue them on and to maintain that. Dry eye, meibomian gland disease. Again, great treatment for dry eyes and meibomian gland disease. Gets rid of specifically for meibomian gland disease. As we know, when those oils are kind of built up there, we also get lipase, and that causes that frothy tear film. And Avenova is a great tool to help control that lipase and minimize that frothiness that occurs, which of course then irritates the surface of the eye. All that debris gets inside the eye. All that those chemicals irritate the eye, and this is again, Avenova is a great tool to help with that. Contact lens discomfort, same thing. Again, patients who have contact lens discomfort, this is great for them. Eyelash extensions, you can see those a mile away. Literally, I think the eyelash extensions just keep getting longer and longer. And this is a great product for them because they're afraid to rub their eye or do anything around their eyes because they're going to potentially cause those eyelash extensions to fall out or not look uniform the way they want them to. So those patients are notorious for just avoiding the eye area. And hypochlorous acid, Avenova is a great spray that lets them spray and then just gently kind of dab the lashes just to get rid of a lot of that buildup of bacteria, mites, debris, everything that we don't want, and that ends up in the tear film and irritates their eyes. So great for patients who have eyelash extensions. Great as an adjunct to in-office procedures. Patients pay lots of money. The picture here shows LipiFlow, but we've had lots of advances past LipiFlow now since then, and LipiFlow, of course, still has a place, but we're doing radio frequency, we're doing IPL, we're doing LLT therapy, all those therapies that our patients are, paying big bucks out of pocket for. Again, Avenova is a great way to extend their relief from and extend the benefits of the treatment that you've done. And of course, pre and post surgery. Again, these pre-surgery, it's a great way to prep the eye. And I was in New York City for many years, and I know that there was a few cases of endophthalmitis at one point, and the retinal surgeon said, "Well, everything we've been, there was a series of them, and they cultured it, and of course it was staph epi, and he was just frustrated because that's certainly something that we could have avoided. It was from the lashes and from the improper betadine prep, but this is a great way to preoperatively help prepare the patient for your surgeon, and a great way to, again, postoperatively. Of course, most surgeons are no longer placing sutures, and so the thermal closure of the wound has been very successful. But of course, we're all checking that wound by putting in fluorescein same day or 1 day post-op, and occasionally there's an open wound. So minimizing that bacterial count post-operatively is just as important as it is pre-operatively. And next. So again, down to a science. Some of this stuff we've already gone over. Again, it helps the bacterial, causes the lipid to break down and releases lipase, which again blocks the glands and causes inflammation. So this really targets the root cause of meibomian gland disease. Certainly helps us, again, in addition to all the other treatments we're doing for meibomian gland disease. And there's just this vicious cycle that starts with inflammation, and you can really enter this anywhere in this cycle. But once you have that bacterial overpopulation, you're going to get it going with the release of lipase toxins, eyelid inflammation, lipid changes, and then of course, as the lipid changes, you cause more bacterial overpopulation. So this just keeps cycling through it. No matter where you are on this cycle, the Avenova is a great way to stop that. Next. So again, highly effective bacterial count, penetrates the biofilm, neutralizes lipases, and reduces inflammation. So that's what we know that it does. Why it's effective. So what do we have to worry about? And really, there's nothing. There's no known risks or downsides. There's no irritation or stinging. It's not an antibiotic, so you're not worried about building up resistance. We've all had those patients who seem to come in every month or every couple months, and then they have this breakout of bacterial infection, and their lids are matted together. This is a great way to help those patients control that and not have to chronically have to put them back on the antibiotics. No contraindications for overuse. Again, you really can't overuse this. There is no age, pregnancy, or lactation restrictions, so very safe. Like I said, when my rep first came in to visit me over a decade ago, he sprayed it everywhere, and he just to make the point that it was safe and not going to cause any irritation or cause any harm. Next. So again, I like it twice a day. It's simple. You wash your face, spray your lids with your eyes closed, and then you can spray 2 or 3 sprays. I think you really just need one. It's a pretty long mist, and so if you just kind of hold it, if you got it at the right spot, just one long mist should cover your whole lid, and then you can dab it dry with either a makeup removing wipe, or the Avenova actually makes a wipe that you can dispense to your patients as well. That's a lint-free wipe that works really well. So really easy, again, twice a day, just like brushing your teeth, and it's just one more thing for them to do. But if they've already washed their face, that they clearly care about their hygiene, and adding this in shouldn't be another big task. Next. So yeah, they have lots of products, and I will let the team take over from here.
Right. Well, thank you so much, Dr. Boparai, for highlighting the clinical uses and benefits of Avenova, as well as an overview on Avenova's purity, efficacy, safety, and value, as well as its ease of use with our doctors tonight. Our family has grown. We are now offering a full line of companion products, including the Nova wipes that Doctor just mentioned, the dry wipes to be used in conjunction with the Avenova spray. It's a spray and a wipe use mechanism to remove the microorganisms. We also have Avenova eye compress, as well as our lubricant eye drops and the eye check, which allows patients to monitor their lids and lashes at home. We'll discuss the availability of sampling Avenova, as well as all of these products in the next slide or two. All righty, so there are 3 ways that you can recommend Avenova to your patients for purchase. We've always been available for you to purchase and retail in practice, but we've added other channels to the market as well. This slide illustrates all the ways that NovaBay has worked to ensure that your patient can make lid and lash hygiene a regular part of their daily routines. We offer the in-practice dispensing program so that you can get Avenova into the hands of your patients and onto their lids that very day. We offer wholesale pricing to you, so this ensures the patient gets the product that you recommend. As attendees today, we're offering you an additional 20% discount off the wholesale price of Avenova with the discount promo that Bree will share with you in a moment through the chat. You can also write a prescription for Avenova, and your patient can fill it at their pharmacy of choice, but you can reduce the prior authorizations by using one of our many specialty pharmacies across the country, which includes Imprimis RX pharmacy, and they give your patients a discount pricing and free home delivery. And lastly, Avenova OTC is available at avenova.com, Amazon, and Walmart.com. This option offers your patients a really easy solution and way to get the product into their hands at less than $1 per day. And that's a really small price for your patients to pay for symptom relief, almost immediate symptom relief. And we're coming to a close in the best slide of the deck, and those are what we're offering to you today. And they include a lunch and learn. We'd love to sit down with you and have an in-depth discussion about the product over lunch, tailored to meet the needs of your practice and your patients. And we're happy to spend as much time as you'd like, but again, it can be as brief as 20 to 30 minutes. And I think Bree is going to share that link for a lunch and learn as well. And the second thing is free samples. And please feel free. Again, we'll share the link to go to our website, request samples. And once you request samples, we'll give you a call or send you a quick email. If you're interested in any of our companion products, let us know. We'll include those as well with the samples of Avenova with the trials. And lastly, we have a great way for you to buy Avenova immediately, and again, get it into the hands of your patients with that 20% off the wholesale price of Avenova. And if you're a new doctor, give us a call, email us. We have a great buy 2 cases, get 2 cases free, and that's $7.50 per bottle with an MSRP of $30 for your practice. Again, a great revenue driver for you. I think we're getting to the end. And of course, our mantra is, if you have eyes, you should use Avenova. It's safe, easy, effective, and affordable. We have tons of product and support resources for you. Please schedule a lunch and learn, order samples. Let us have a quick conversation with you. And we're going to end our discussion tonight and open the floor up for any questions.
Yeah, if you have any questions, please feel free to drop them in the Q&A or the chat right now.
While we're waiting, I do want to mention that there are a few other hypochlorous acid products on the market, and they're not the same. With hypochlorous acid, the Avenova is the only one that is pure hypochlorous acid. So the only 2 ingredients in there are hypochlorous acid and saline. If you look at the other products, there's long words that are hard to pronounce that are included in their ingredient list, and as well, the Avenova is unique in that it comes in this glass bottle, this brown glass bottle. So there's nothing that's going to leak into or be leached into, rather, into the product like there would be, say, from a plastic bottle. So that is unique for Avenova, and they have a patent on that, so it's not something that anybody else can copy.
We have some questions related to the amniotic membrane and affixing it without sutures. Can you talk a little bit about that?
Sure. I use a lot of amniotic membranes. So there's different ways you can do it. I prefer to, I know you guys all just came out of an amniotic membrane lecture. How I personally do it, I'm not sure, I didn't get a chance to listen to the other lecture. I might be saying something different than how the other doctor does it, but I prefer to put a bandage contact lens over the dry amniotic membrane if I'm using a dry amniotic membrane. Uh, there are some doctors that will just put the dry amniotic membrane on and then do a tape tarsorrhaphy where they tape the lid closed or partially closed. I personally, again, I haven't had any problems with the bandage contact lens. It makes me feel like they can still open their eye. They can still go to work. They don't look any different than the eye that we treated doesn't look any different than the eye that we didn't treat. And I do usually, unless it's urgent or an emergency, usually we'll only treat one eye at a time. Um, and so it allows them to go about their life and not have this amniotic tissue that's on their eye that's healing their eye and regenerating the corneal epithelial cells. That doesn't hinder them from carrying on.
Great, thank you. Can you talk a little bit about how long Avenova is effective after the bottle is opened, and if there are any age restrictions?
Sure. So the bottle is good. It's good for 30 days, and then using it twice a day for 30 days, that you should uh, go through the whole bottle at that point. After 30 days, you don't necessarily have to throw it away, but it's just not as effective. It starts to lose its efficacy, and the longer it sort of sits out there past the 30 days, it's really just turning into water. So the effectiveness of it, again, 30 days, and again, if you're using it twice a day and you're having your patients use it twice a day, you should burn through it in that 30 days. As far as restrictions on age, again, there are no restrictions on age. I have lots of high school kids on it, even pediatric kids. Again, for those kids with that blepharitis that's just really stubborn. I remember I went to grade school with a kid, and he always had crusties in his lid. And at that time, we, in a very mean way, his nickname was Krusty, and that all he had to do nowadays. There's no reason for that to occur because it's safe enough to use for small kids. You wouldn't want to put a small young child on repeated doses of antibiotics, which at that time was the only treatment that they had beyond lid hygiene. But the blepharitis can really be managed now with Avenova, and again, it's great for kids from birth on up.
Great. Well, it doesn't look like we have any more questions. If you have a question, please feel free to drop it in the chat or in the Q&A now. Otherwise, we will wrap up. We'd like to remind everybody that Avenova is FSA and HSA eligible for your patients. It's that time of year where everybody's starting to look at what they have left over and use it. So Avenova is a great option to use up their FSA benefits. And thank you, Dr. Boparai, for spending your time with us and sharing your experiences with Avenova to the group.
Great. Thank you all. Have a great night. And if there's any questions, the team knows how to get a hold of me. I'm happy to answer anything in the future.
Great. Thank you.
Thank you.
Thanks all.